Hi everyone, Tom Meadmore here. We're gearing up for the crowdfunding launch next Tuesday, the 8th of November at 12 o'clock, and we're speaking to various people this week. Today I've got the absolute pleasure of speaking to none other than Karol Sikora, who is a... Well, Karol, would you like to introduce yourself for us? Tell us a little bit about what you do.
Okay, so I've been an NHS consultant for 37 years. I was very young when I started. I'm now very old, as you can see. But I worked mainly at Hammersmith Hospital in West London. More recently, we've been setting up cancer centres in the private sector for the NHS, and NHS patients are using them. Nicely designed, nice atmosphere, car parking and so on, trying to get the journey of a cancer patient away from the big hospital environment. And so it's been very challenging. I've been a great supporter of complementary therapy, although now and again we do have problems with alternative people going off and doing rather bizarre treatments.
Well, could you expand on that? Because complementary is... expand on what do you mean by that? Because it's actually quite... Within the NHS, that's quite a controversial... It can be very controversial.
It can. Complementary medicine is harmless. In fact, it's beneficial. It involves talking therapies, touching therapies, and sometimes dietary change, exercise, and so on. And it's all about adjusting the lifestyle to get you the best possible response to the cancer. Alternative medicine is throwing out chemotherapy, radiotherapy, surgery, and just doing the alternative. Although everybody has their own belief system. And I guess what we've done over the last 30 years is respect that belief system. And that's something that is really important. If someone really wants to do that, we have to help them do it. Not all my colleagues believe that. They think they should be right.
Because that's actually, I've spoken to a number of people that would say that is a completely, within the medical system, it's a completely wrong way of looking at it. That unless there's evidence, it's alternative and it's rubbish and potentially harmful. So do you find that you get...
I'm a bit more open than most, but having said that, there are rip-off places around the world where you can go to where you extract 50 or 100,000 pounds. All around the world these clinics exist, and there's no proven value and there's no data collected. And the great thing about orthodox medicine, which is what I've been trained in and worked all my life, is that we collect the data and analyse it, and the publications and the medical libraries around the world tells you the experience of clinical trials and so on. By its nature, alternative medicine doesn't have the resource to do that. So it's one of the biggest criticisms, there's no research going on, and that's sort of slightly unfair because they don't have the capacity to do the research. And also many of these clinics, patient goes there for a week or two and then goes away, they never see them again, so there's not much follow-up data. So some of the criticisms are probably unfounded. The real problem though is, are we letting patients go and take something when they could have something that's very beneficial? So for example, young man with Hodgkin's disease, curable, 98% chance of complete cure with chemotherapy. What would I do if he said, I don't want chemotherapy, I'm going off to Switzerland to some bizarro clinic? I put a lot of time and effort to try and persuade him to have the chemotherapy, as well going to the bizarro clinic. If he wants to do it, that's fine, it's his money. But have the chemotherapy when it's 100% successful. Unfortunately, many cancer patients are not in that circumstance. They've got metastatic cancer, cancers that spread around the body, and the chemotherapy may give them months, maybe a year of extra life. So if they want to go on a journey to do something, I encourage them to do it. They'll feel better.
That must be difficult as an oncologist to sort of confront that situation.
The most difficult, I can remember vividly the lady who's sadly died, early breast cancer. Now this is 95% curable with conventional treatment. She refused treatment, but she wanted to come back for follow-up. And I just monitored it. I monitored it with serial ultrasounds. You could measure the tumour size in the breast. Eventually it spread to the lymph node, then it spread to the liver, to the lung, and then to her brain. And then she died. Now, that was so frustrating, because if she did what I told her to at the beginning, she almost certainly... And she was a manager of a travel agency. She was an intelligent woman, an educated woman. And I just couldn't work out what I could do to persuade her. And she was doing all sorts of alternatives as well, but they weren't working, and I could show her they weren't working, so why not come to conventional? So I think the debate is sort of slightly unhealthy, because we're polarised, and what we've got to do is learn from both sides.
Okay, so that brings us back to the film. You've seen the trailer for the film?
I have.
Could you tell me your impression of what you've seen?
I thought it was brilliant. The cuts between the different scenes, fast-paced, And, very interesting for me to see that, beautifully constructed. I hope the real film, when it comes, will be as good as that in terms of technical quality. I think how it goes depends who's going to be on it and how it's filmed and all the rest of it. But it could be a fascinating insight into the world of cancer.
Do you think that there's a place for it and a need for a discussion of this nature at the moment?
I think there is. There's no doubt that we need something to hang it on, and a film like this could be exactly the product we need to hang on the way in which complementary, alternative and orthodox medicine all work together. And I guess the goal of all of them is the same, to improve the quality of life for a patient. So educating people in this world is pretty important, and educating them where the pitfalls are. Some of my colleagues are not so happy about things I say, and I'm pretty mild. So imagine what they'd be like if they were faced with a real alternative person.
Yeah. All right. Thank you, Karol.
Okay.
And thank you, everyone. Tuesday, 12 o'clock, midday, we're going live. And Tuesday night, we've got a Facebook Live event where we're going to be talking to a number of different people to celebrate the campaign launch. So tune in then. Thanks, everyone.